Hello and welcome to another episode of 360 Health. I am Ogechukwu Ukekwe. The Coordinating Minister of Health and Social Welfare, Ali Party, has pledged government readiness to support the establishment of more poisoning treatment centers in Nigeria. The minister made the pledge during the closing section of the two-day workshop on integrating and strengthening emergency care for poison patients in West Africa in Abuja. The workshop was convened by Abdulrazak Habib of Barrow University, Kano State. The minister said that poison from animal could cause chronic kidney diseases if not treated properly, and reiterated the government's willingness to support treatment centers in Nigeria. We'll go on a short break, but when we return, we'll be joined by our guests and also to speak on breast cancer. Don't go away. Welcome back. Breast cancer is one of the most common diseases affecting women worldwide, characterized by uncontrolled growth of cells in breast tissues. It poses significant health challenges due to its prevalence, the complexity of the treatment, and its psychological impact on patients. According to the World Health Organization, about 2.3 million women were diagnosed with breast cancer in 2020, and it led to 685,000 of deaths. The incidence rate is higher in developed countries, likely due to lifestyle factors and better detection rates, while mortality rates are higher in less developed regions due to limited access to treatment. Well, joining me on the program to discuss further is Managing Director, Life Found Hospital, Dr. Rebecca Adeyeye. Thank you for joining me on the program, Doctor. So as an expert, can you widen our knowledge on what breast cancer is?
Breast cancer, I'm sure everyone knows what a breast is. I think that's where we should start from. So breast is an organ that is on the chest, the upper part of the chest. Another word for it is the mammary gland. And I would like to say at this point that both males and females have breasts. Because many times when we talk about breasts, people just feel that it's only the female that have the breasts, but no, males too have breasts. It's just that it's well developed in females compared to males. So now that we have solved what breast is, so we'll go to what is breast cancer. So breast cancer is the growth of abnormal cells in the breast. Okay, so this is what I like to say. When a child is growing in the womb, the child grows from a cell and cells keep multiplying to make more cells, right? And I like to tell people that even for our hands to develop, it usually develops like a piece like this. But a part of the body tells the body that, okay, all the cells in this area, you should die off. So that makes it into the fingers. So there is a central control in the body that tells the body to grow. And there's also a central control that tells the body to stop growing. And that's how we are formed as human beings. So when the cells in the body, the normal cells, takes instruction to keep growing, and does not listen to stop growing. You understand? So we have a tumor. So when that tumor, when we now have, and that's what makes the difference between, so when you say a tumor, both cancers and non-cancers are called tumors. Okay. Means growth. But when it's called cancer, when it has the ability to grow beyond its borders. I'm trying to explain so that a layman will understand what cancer is. So that when it comes to treatment, you understand why those treatments are the way they are. Yeah. Because in the real sense, it's actually the body itself that is, I would like to use the word like it's going crazy. Mm-hmm. Do you get it? So that's where we have, so if it happens in the breast, we call it breast cancer. If it happens in the stomach, you'll be stomach cancer. Do you get it? So depending on whichever part of the body we have these cells that are growing in a bizarre way, that's what cancer is.
So what would you say are the common early symptoms of breast cancer, and when should one seek medical attention if they notice these symptoms?
The common early symptoms of breast cancer includes lump, or you may want to call it mass, or you want to call it growth or swelling in the breast. So those are the early symptoms. Though, so for some people, it could also present with some changes in the size of the breast. So I want to believe that I do tell people that everybody, you are your own first doctor. So you need attention to yourself. So yes, we are doctors qualified to help, but you, the owner of the body, for adults and for children, the caregivers, we need to pay attention to their bodies. Do you understand? So when you notice that something is going wrong, so for someone who has breast and you notice that all of a sudden, gradually just start noticing that the size of one breast is different from the other, and it wasn't so before, it may also be a pointer that something is wrong or something is happening. Also, you also want to look at the changes of the skin. So for some people, they've just discovered there is a kind of redness around an area of their breast, or deeply, you know, um, oranges or lemon, you can see how the back is. So human skin is usually not like that. So if you notice any of these variations, it could just be a pointer that breast cancer or breast disease is happening in that breast. Another thing is also nipple discharge. If you notice any discharge, you're not breastfeeding, you're having nipple discharge. I know that there's another disease where someone can have breast milk when he's not breastfeeding. But if any other discoloration that is not breast milk, even with that, you should also seek help from your doctors. But if you see any other discharge too, it's a pointer that something is wrong or is happening, and you need to seek attention promptly so that you can be evaluated. And please, when you have sought the attention and you have gotten the evaluation, please follow treatment promptly, because that's where the challenge is now. People get to know that, okay, this is where the challenge is, but it takes them forever to accept treatments.
So what are the latest advancements in treatment options for breast cancer, and how do you compare it with the traditional method in terms of effectiveness and side effects?
Of course, there are a lot of advancements um, in breast cancer treatments. A lot is happening right now, and there are targeted therapies now that can be used in treating breast cancer. So before, I used to be a blanket treatment where everybody just gets maybe similar drugs, similar things. But now, in order to get a very, very excellent outcome, we need to first know what are the type of cancer that the person has. So the fact that 2 people or 3 people have breast cancer does not mean that they will get the same treatment. So the treatments are individualized. So when samples are taken to the lab to check what exactly is the composition of that particular cancer. So this will help to know which line of treatment. Number one, it help us to know the staging. So for breast cancer treatment, number one, it has to be staged. So it's the staging that will help us to know which direction to go. Then the second thing that is important in treatment of breast cancer is also to know the type of cancer that the person has, the type and the stage. So these 2 things are very important in the treatment of breast cancer. And then, like I said, we have targeted therapies like immunotherapy and precision medicine, which can be more effective with potentially fewer side effects compared to the traditional methods like chemotherapy. These new approaches often work by targeting the specific molecular features of the cancer cell. So if you don't mind, I may expand on that a little more.
Yes,
Would you
please.
like me to do that? Okay.
Yes, please.
All right. So when we take the samples for test, so there's a kind of test we also do for people who have breast cancer. We do immunohistochemistry, in which we want to know if this particular um, cancer has hormone receptors that will respond to hormone therapy. Hormone therapy like tamoxifen. Tamoxifen is an oral drug, though there are some other drugs that, we use in cancer care that is systemic, but this particular one is tamoxifen, hormonal therapy, or the ones that are positive to HER2 receptors. So these are some technical things that we check that helps us to know which particular drugs that the patient will need to take. So for those who are HER2 receptor, have these HER2 receptors, they will take immunotherapies like Herceptin. Herceptin is a more expensive chemotherapy, and the patients, at least there was a time that was as expensive as 350,000 naira for a vial, and the patient would take it every 3 weeks for like 18 courses, almost a year. So, so all these things call for, makes the burden of the care for breast cancer very heavy on people who have those types. So the type determine the care that the patients will get.
Okay. So what would you say are the most effective preventive measures individuals can take to reduce the risk of developing breast cancer?
The preventive measures the that patients can take, it's some things that we've known about, like maintaining a healthy weight. It's also a good preventive measure. Regular physical activity. Regular physical activity. We are in an era where almost everyone, is either behind a screen like a computer, or
Yeah.
you're seated with your phone doing things, or even those who are not working, they are surfing social media and they are there for a long time. So we need to include physical activities into our routine, into our lives. So if you sit for a while, just stand up, do something, move around, do some exercise while you continue what you are doing. So activities, physical activity, then we limiting alcohol consumption also can help. Then for those who are, we usually tell people avoid smoking, avoid smoking. So it's a good lifestyle activity to avoid smoking. Then breastfeeding offers some level of protection. Breastfeeding. And also, we also advise people to always discuss with their doctors to know what's appropriate medication they can take. I'm saying this because for some people, they actually don't have the breast cancer yet, but they have family history, strong family history of breast cancer. Probably, their mom had breast cancer, their sister had breast cancer, their auntie had breast cancer. It could be a strong indication that they also have genes in them that can also predispose them to breast cancer. So for such people, there are some preventive medications too that can, be, they can start on, especially if they do not want to take the option of surgery as a preventive step, so that they won't have it.
So, okay, you talked about stages. Can you tell us the different stages of breast cancer and how the treatment approaches vary depending on the stage of diagnosis?
All right. So for breast cancer, usually if there are cancer cells on, if anyone has cancer cell, so for stages of breast cancer, um, if anyone develop breast cancer, it will start small before it gets to what everyone can see. So at that stage where you cannot even see it, there's a way the body wants to protect you from disease. So in that way, the cancer cells are walled off with a thin layer of, of cells by a plate called basement membrane, in which you walled it off so that it will not quickly just spread around. And that stage where someone has cancer cells growing is called stage 1. It's called stage 0. I apologize. So at the stage where the cancer cells have started growing, though you've not seen it or you've not even felt it, is called stage 0. So for every time cancer cells are growing in the breast, so the breast develop like a wall around, it's called basement membrane. So when the cancer cell is within that basement membrane, it's called stage 0. And this is the best time to detect breast cancer, because the prognosis of cure is high at this rate. And that is the reason why we do breast screening, to get people when they themselves don't even know that they already have breast cancer. And that is the advantage of breast screening, to get people, to catch them at stage 0. So stage 1, usually we use the TNM staging. So TNM means tumor node and metastasis staging. So we want to say stage 1, the person has a lump. That's stage 1. So we talk about stage 0. The cancer cells are there, but probably you don't even know. You can't even feel a lump. But stage 1, there is a lump, and that's the only thing that is in the breast, the lump. Stage 2, there is lump. There is also lymph node in the armpit. But this lymph node, when you touch it, you can see that it's mobile, in the sense that it can move, it moves around. It's like it's rubbery and it's moving around. It's not attached to a point. So that's stage 3. Okay, I'll talk about stage 4 before talking about stage 3. So stage 4 is when there is spread to other parts of the body. But anyone that has anything that it's more than stage 2, but we can't fully say stage 4, that's stage 3. All right. So for stage 0, the best form of treatment is surgery. I think before I go on to the treatment for each options or modality for each stage, I would like to talk about this breast self-examination. Okay. Self-examination. It's very important for every woman to do breast self-examination. We usually advise that they should do it, females should do it between the 7th and 10th day of their menstrual cycle. So let's assume that today is day 1 of the menstrual cycle. So before you do it, make sure that after that day 1, you counted day 1, 2, 3. Between the 7th and the 10th day is when you should do it. And it's for a reason, because it's believed scientifically, when a woman is menstruating, there are some hormones in the body that makes all those to happen. And sometimes they also affect the fullness of the breast. So if you examine your breast around that time, you may not be able to tell if what you are feeling is just fullness because of your hormones, or because you're menstruating, you're having your monthly flow, or because something is happening. So it's usually advised, women are usually advised that if you want to do your breast self-examination, do it between the 7th and the 10th day of your menstrual cycle. Okay. So that's the best time to check. When you notice anything, you then go to the hospital and make sure that you are being seen by a doctor that evaluates you further. All right, so back to our staging. So stage 0, it's surgery that is the modality for treatment. For stage 1 and 2, surgery plus or minus drug therapies. So surgery plus or minus drug therapy is your doctor, your specialist, that will let you know if you need to add any other therapy to the surgery that you will do. So it could be in addition to drug therapies or hormonal therapy, immunotherapy, or even targeted therapy. Then for stage 3, the person will definitely need systemic or drug treatment. Then the person will still take surgery. In order to reduce systemic and prevent spread before surgery. So for those who are in stage 3, they will take some form of drug treatment. before they will have surgery. Then for those who they will have surgery, then after the surgery, radiotherapy will also be advised. Okay. So for stage 3, there's chemotherapy to reduce the spread or prevent the spread, then surgery, afterwards radiotherapy. So it's like a 3-layered kind of treatment for stage 3. Then for stage 4, usually they take systemic therapy and radiotherapy. They only take surgery. They only surgery is only advised if there is need to, to take care of the local sites. Maybe it's bleeding or is infected or ulcerated. So the local site is not the main focus at stage 4. The main focus is systemic therapy, and in order to treat to curtail spread, that's what we just try to do at stage 4.
So for individuals undergoing breast cancer treatment, what are some strategies for managing treatment-related side effects and maintaining overall well-being?
For individuals undergoing breast cancer treatment, the strategies to help them in managing side effects includes they should have balanced diets. They should also try to stay physically active and seek emotional support. They need a lot of emotional support. It's very, very important because, cancer treatment is really draining on the emotion, drains finances, gives a lot of stress. So, so the person needs a lot of emotional support at this time from those they trust. Because another thing is that, when people are going through very difficult times, they listen better to people they trust. So their support system, they should also leverage on it, because what we've discovered is that when people are going through this kind of treatment, they tend to keep it to themselves alone. There are people that can even support them. They don't even know what they are going through. So I want to advise anyone going through it, please get all the emotional support you can get. Is very, very important. And also, they should discuss medication options with their healthcare provider so that it can alleviate symptoms like nausea, tiredness, or pain.
So do breast cancer have a risk of reoccurrence after the necessary treatments?
Of course, there are risks of reoccurrence. And that's why for people who are going through treatments, they will be informed how often they should come. And also, they should always have, I believe that for healthcare providers, for specialists and doctors that are caring for these people, for the nursing, the team, usually it's a team that takes care of someone going through cancer, any kind of cancer. But in this case, breast cancer, they should have an open, communication system where they can easily communicate with their team. It may not be with the doctor directly, but of course, there will be someone who is like a liaison between them and the care team. So they should always communicate anytime they have any challenge. It's very important, because if anything is going to happen, they will also be the one to first know that, oh, this is happening. But at the same time, they will also be given follow-up dates. So they should make sure they do the right thing by going for their follow-ups. And also, if anything spring up between follow-up times, they should also reach out. But reoccurrence is possible. And in order to prevent this reoccurrence, that's why all these follow-ups are prescribed, and also open channel of communication is also made available. And support teams too at the hospital are also there.
So what are some of the potential long-term effects or complications of breast cancer treatment, and how can patients mitigate or manage this?
Yeah, long-term effects of breast cancer treatments can include fatigue, infertility, bone loss, heart problems, secondary cancers. Patients can mitigate this by following a healthy lifestyle, regular follow-up, like I've said, follow-up care, and discussing potential risk with their healthcare team. And the healthcare team also discussing with them of whatever challenges they could face. And if they also find any challenge, they should also discuss with their team. So That's what I have to say.
Well, Managing Director, Life Found Hospital, Dr. Rebecca Adeyeye, thank you for lending your thoughts on the program. And that's it on this episode of the program. Many thanks for watching. See you next time.